So our healthcare systems are about to undergo a profound change, and one of the most important things is the implementation of the European Health Data Space. So European Health Data Space will lead to digitalization of all of our health records, which will be made into electronic health records. They will be harmonized across the EU, and we will be able to exchange them and to use them, for instance, when we travel, when we cross the border, etc. Medical doctors will be able to see our medical data in other member states, and they will be able to prescribe us with the right treatment without the need to undergo unnecessary tests, unnecessary additional diagnostics, etc. So in terms of this so-called primary care, this will be a major breakthrough. But in also secondary use of data, so this is the use of data for policy purposes, for research purposes, etc., will also make a big change because it will make it possible for us to use the data which has not been used up until now. And in terms of research, in terms of innovation, creating new medical technologies, this is of extreme importance. What we discussed today in the event is how this will be implemented. And I think this is the most important thing, because it's not enough to just make legislation, it's important to implement it, to create a right legal framework that this becomes operational in the next 4 to 5 years, and that our European patients really benefit from this common European health data space. I'm glad that we were able to speak with all the relevant stakeholders that were organized here, that we also heard their input, because it's important for us when we make policy decisions to hear what's the situation on the ground. And I believe that by all of us working together, so the industry, the healthcare professionals, the patient groups, etc., that by all of us working together, we'll be able to create much better healthcare than it is now for all European patients.